Hello friends, let us now learn some important points about central sympatholytics. Okay. So first in this lesson we are going to learn about the hypertensive drugs. So in the hypertensive drugs, first we will learn about central sympatholytics. So these are actually alpha 2 agonists. These alpha 2 agonists will activate the alpha 2 receptors, and thus they will decrease the noradrenaline, dopamine and 5-HT2 release. And whenever there is decreased noradrenaline, decreased dopamine and decreased 5-HT2, this will decrease the sympathetic outflow from the vasomotor center, and thus this will decrease the heart rate, decrease the cardiac output, thus decreasing the blood pressure. And this decrease in sympathetic outflow in the blood vessels, it will decrease the peripheral vascular resistance and thus decreases the blood pressure. Okay, the first drug which we are going to see here is Clonidine. This Clonidine is given orally, and this is highly lipid soluble drug which crosses the blood brain barrier, and it has shorter duration of action, which is given twice per day administration, or it can also be given as a transdermal patch. We also have transdermal patch of Clonidine which is available, and it can be given for 1 week. So this Clonidine is a drug which is used in hypertension. So the uses are, these are used in hypertension, and this is also used in withdrawal in order to counteract the withdrawal symptoms of smoking, alcohol or opioid. Actually, it is the drug of choice for autonomic diarrhea which is seen in diabetes mellitus, and it is an antidiarrheal drug which is used in diabetic neuropathy. So if you see the side effects for Clonidine, it can cause dryness of mouth, dryness of eyes, it can cause dryness of mouth also, it can cause sedation, depression or bradycardia. It can even cause hypotension, postural hypotension can occur, nausea, vomiting, it can cause impotence and parotid gland swelling. Then if we stop this drug suddenly, sudden stoppage of this drug after prolonged use can result in withdrawal syndrome. In the withdrawal syndrome, the patient suffers from headache, nervousness, tachycardia, sweating, tremors, and he also has rebound hypertension. So this rebound hypertension is seen in Clonidine, and it is very important. This rebound hypertension is actually treated by phentolamine. It is treated by phentolamine. So because of this rebound hypertension, this is not given in patients with traveling jobs. It is not given in patients with traveling jobs due to this rebound hypertension and withdrawal syndrome, right? So this is about the Clonidine. And one more thing, this Clonidine is safer drug in pregnancy, right? Now the next central sympatholytic or alpha 2 blocker used in pregnancy is Methyl Dopa. This Methyl Dopa is also it is actually preferred drug in pregnancy, and this Methyl Dopa will activate. This is the similar way. First we have alpha methyl dopa which will enter the neuron, and it forms alpha methyl dopamine which will enter and it forms alpha methyl noradrenaline. This alpha methyl noradrenaline is released into the synapse. Okay, now it will act on the autoreceptor, that is alpha 2 receptors. It will activate alpha 2 receptors, and thus these alpha 2 receptors, being the autoreceptors, they decrease the release of adrenaline and noradrenaline, and as a result these will cause decrease in heart rate and decrease in peripheral vascular resistance, and as a result they will cause decrease in blood pressure, right? So if you see the side effects of alpha methyl dopa include, they cause sedation, they will increase prolactin levels which will cause lactation. Because of this increased prolactin levels, there is side effects of gynecomastia, right? So there are side effects of gynecomastia, impotence are seen, and there can be hepatitis is also seen as a side effect. So these are the side effects of alpha methyl dopa. So there are some one liners. If you were asked what are the antihypertensive drugs which are safer in pregnancy, then we have the following list. Labetalol is actually the drug of choice in pregnancy. Okay, then if you were asked alpha methyl dopa can also be given in pregnancy, and we have hydralazine and also calcium channel blockers can be given in pregnancy. Okay, so what are the drugs which are contraindicated in pregnancy? In pregnancy, the drugs which are contraindicated are ACE inhibitors, angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, diuretics, and nitroprusside are contraindicated in pregnancy. Then the congeners, then you should learn about some of the congeners of clonidine, central sympatholytics. So congeners of clonidine we have two. One we have moxonide, second we have rilmenide. This moxonide and rilmenide are the congeners of clonidine. These have longer half-life and they are selective for imidazoline receptors. They are selective for imidazoline receptors, and as a result they will modulate alpha 2 receptor activity. Thank you for watching.